We build that confidence, support staff, build that confidence for women across the family to have that time, a good time when they are going through maternity services.
Joani Reid.
Question number 4, Mr Speaker.
Secretary of State.
Thank you, Mr Speaker. I'm grateful to Professor Sullivan for her report. Sex and gender identity are not always the same, and it is important for patients that we record both accurately. I know the House will share my concern at some of the findings from Professor Sullivan's report, like trans patients not being invited for cancer screening because of how their gender is recorded. I can assure the House I'm already acting on the report. Last week I instructed the Health Service to immediately suspend applications for NHS number changes for under 18s to safeguard children. Taking such action does not prevent the NHS from recording, recognising and respecting trans people's gender identity.
Joani Reid.
Thank you, Mr Speaker. Can I thank the Secretary of State for that reply, and it will give much needed reassurance to patients across the UK. Any public body that fails to accurately record sex and instead conflates it with gender put people at serious risk of harm. Unfortunately, this type of organisational capture has been widespread across Scotland with devastating consequences. Can the Secretary of State assure me that he will raise this with his counterparts in the Scottish Government to ensure that NHS Scotland does not put my constituents at risk?
I'm grateful to my honourable friend for her question. I will absolutely give that undertaking to share with my counterparts across the United Kingdom the approach we're taking. The approach I've always taken is one that understands the importance of biological sex, that recognises, understands and supports that someone's gender identity may not always match biological sex, and to navigate a way through what has been an extremely toxic, sometimes harmful debate in a way that protects the sex-based rights of women and protects trans people and their identity. I know my colleagues across government are taking an equally sensitive approach. I think it would be in everyone's interest if we saw a similar approach across the whole of the United Kingdom, and not just in the provision of services, but in accurate data and research. It is important we make that distinction, which doesn't in any way undermine respecting the gender identity of people.
Liz Jarvis.
Thank you, Mr Speaker. The inquest into the tragic death of a young woman who lived in Eastleigh has highlighted the importance of continuity of specialist care for vulnerable people who move home. My constituent Alex is still waiting for an appointment for ongoing specialist care 3 years after moving to Eastleigh. So will the Minister meet with me to discuss the provision of mental health care in my constituency?
It's about sex gender. That's the problem with the question. Don't worry, I'm sure they'll pick up the Secretary of State's got the message. Right, can I come to the front bench? Dr Caroline Johnson.
Thank you, Mr Speaker. Given the Sullivan Review findings on patient safety and health safety as a result of inaccurate or poor data collection, can the Right Honourable Gentleman confirm what meetings he's had with the Secretary of State for Science, Innovation and Technology to discuss the reliability of data on sex intended to be used by the digital verification platform in the data bill?
Sir.
I'm grateful to the Shadow Minister for her question. I speak to the Science Secretary on too frequent a basis, on a daily basis. He and I are both looking very carefully at the findings of the Sullivan Review and working through its implications for both the health and care services I'm responsible for and for the government digital and data services that he is responsible for.
Thank you, Mr Speaker. The UK Health Security Agency, for which the Secretary of State is responsible, publishes health statistics. This includes data on sexually transmitted infections that are published by sexual orientation and sex. But a footnote states that women are defined in the data set as women and trans women, which does undermine somewhat the value of the data. So what will the Secretary of State do to ensure that data is not just collected properly, but is published and presented in a way that is most clinically useful?
Secretary of State.
I think the honourable member raises a actually really good example of how conflation of sex and gender identity isn't helpful, both in terms of data analysis, but also recognising health inequalities and making sure that we are understanding variances between people based on their different backgrounds, different characteristics, and making sure we provide targeted, personalised and effective healthcare that deals with healthcare inequalities. That's why we are studying the recommendations made by Professor Sullivan carefully, with a view to making sure that we're meeting the needs of everyone, including the trans community, who I understand, not least because of the way the debate has been conducted in recent years, are anxious about the implications